Hi, Soumya. I'm just waiting for you to join. Welcome, everyone. Hi, Soumya.
Hi,
Hi.
hi, ma'am. How are you?
I'm fine. Good evening. Happy New Year.
Good evening.
In a
Happy New Year.
face-to-face Happy New Year.
Yeah.
Yeah.
We'll try 5 minutes or
Yeah. We'll wait for a couple of minutes and then go
okay,
ahead and
okay.
get started. Did you get the questions that I?
Yeah, I got them, ma'am. Yeah,
Okay,
we're ready.
fine. Yeah. I think we'll go ahead and start, Soumya.
Okay.
Did you figure out the chat options? I mean, the
Yeah, one
questions.
second. The sticker, right?
Mm.
Just one. I'll just try it out. I'll just try it out 1 second.
Okay.
Yeah, I think I can read the questions here. So,
Okay. Fine. Um, yeah, you can read it. Fine. Okay. So, yeah, welcome to everyone who's joined, and I hope I'm doing this correctly. I think have all of you able to see me?
can you move back a little bit?
Yeah,
Yeah,
is
this
that
is fine.
okay?
Yeah, this is
That's
good.
better.
Yeah,
Okay, fine.
this is fine.
Now it keeps saying send request, send invite. Do I have to do anything, or this is it?
I don't think so. Yeah, this is fine.
Okay, fine. I'm just going to try this. Is that okay?
Yeah,
Or is
no
it too
issues at all.
confusing? Fine.
Yeah.
Okay. Anyway, so let's go ahead
Okay.
and get started. Good evening to everyone who's joined. It's very nice to be here with Soumya, and I think some of you who may join will know Soumya from earlier. And the idea behind this is basically to have a weekly conversation on PCOS. And part of the reason I thought of doing this was because there are so many aspects to PCOS, and we barely sort of scratch the surface when I do a consultation. I talk about various things, and sometimes I feel even the 20 minutes or half an hour I spend is not enough, and there are so many doubts, so many questions. So I thought, till we run out of questions to ask, I thought we can have a weekly 1 hour session. And each week I thought we could focus upon one aspect of PCOS. Today is only going to be about what it is and how do we diagnose PCOS. Um, and as, oops, sorry. And as the weeks go along, I thought we can touch upon things like, why is diet so important? Why is a low carb diet so important? Why is exercise so important? Why do we keep asking you to check your sugars, and so on and so forth? And whatever doubts or other questions or concerns you may have, just please write in the chat box. So the reason I asked Soumya to join me, and I hope she'll be able to join every week, is because Soumya has been looking after people with PCOS, helping them lose weight with the low carb diet. And, we work together on several people who've had very good results in PCOS with the low carb, being able to lose weight and exercise and get their periods back regularly and have multiple other benefits. Their sugars come down. So, what has been your take, Soumya? What is your understanding now of PCOS? What do you understand about it?
Yeah, so like as you've told, we worked together like for past few years and we've seen many PCOS patients. And right now what we notice is that like one thing is each person is different. Though they have PCOS, like each one will be a different category. So but majority wise what we've seen is it is definitely more common now. Maybe it's becoming more diagnosed now before also, but we see so many people having PCOS compared to before. And I think it is more commonly diagnosed in women in like the late teens, early 20s, early 30s and all. But then again, same thing, like because of hormone imbalance, there are various symptoms like ranging from menstrual irregularities to hair fall, acne. There are like so many things. But same thing, like each one is not the same presentation. Like one lady may have a different thing, one can have a different thing. So like so many different presentations. And I think apart from like getting, there's a genetic factor is there, but apart from that, it is more like lifestyle and diet is a very big part in getting disease also. Both in getting the PCOS, its presentation as well as treating it also. So apart from medicines, I think diet is very important, the treatment and exercise also, being a fit lifestyle and all. But anyway, we'll see more about this in like a future sessions. But the gist of it is like this. these points.
Yeah. Yeah. Hi, Devi. I can just see you. I apologize if I don't. Sometimes the comments go too fast and I'm not able to see it. Um, so yeah, I think that's a very important point that you made, Soumya, that it's a very, very, what we would call a heterogeneous. That's the medical term we use for it. But basically, it means that people can present in so many different ways. They can present with, like you said, irregular periods, or they can present with mainly skin problems, particularly in the teen years and in the early 20s. We see people who come to us because of problems with the skin, with the acne, with the excessive hair growth. And so it's sometimes very difficult to understand why should something like PCOS affect so many different things. Why should it cause irregular periods? Why should it cause difficulty getting pregnant? Why should it cause skin problems? And sometimes it may even cause, for example, problems with the gut. A lot of people face problems with indigestion. Constipation, I think, is a very, very common problem, particularly when the PCOS flares up. Mood problems, a lot of people tend to have. It's not just related to, because of some skin problems. A lot of people tend to have, it is associated with depression. And there is a lot of scientific evidence to say that all of this is actually caused by PCOS. And when we try and manage the PCOS, actually, a lot of these things come under control. Um, so one of the things I think you may have also noticed is a lot of confusion about the diagnosis.
Yeah.
If I only have irregular periods, do I have PCOS? I think you may have noticed things like that. I mean, do people who come to you for counseling ask you questions about how was my
Yeah,
PCOS
definitely.
diagnosed?
So
Yeah,
exactly. So most common thing is how is it diagnosed? So do I have it or do I not have it? So that's a
yeah,
very
there
frequently
is
doubt they have.
exactly. And I think
So
even the experts, the people who've been studying it for many, many years, also have a confusion as to whether this is truly PCOS or not. So if you look at,
okay.
even if you look at sort of what we call the scientific definition of PCOS, some people may say you have to have this, and this to make the diagnosis. Other people will say, oh no, you only have this. I think what has changed over the last couple of years is and I
Yeah, I
got cut
got
off.
cut. Okay,
Yeah.
okay. Yeah.
So there is uh, 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 people are understanding that they're present with so many different ways that it doesn't matter. You don't need to have irregular periods all the time. You don't need to have skin problems all the time. You do not need to have even an ultrasound appearance of PCOS all the time to make the diagnosis of the PCOS. You might have any one of these things, even one. It might just be a young girl who presents with, say, acne. It might just be somebody who presents with a little bit of excessive hair growth. So any one or even two of these things may be enough to
Okay.
make a diagnosis of PCOS. Or even, for example, the other sort of the flip side of the coin, I think, and you've also seen it, is that sometimes girls get ultrasound done for other reasons. For
Yeah.
example, they may
Right.
get an ultrasound done for stomach pain, and then the ovaries shows a little bit of something that looks like
Yeah.
polycystic ovaries, and then the
Yeah.
mother gets worried and they come to us and they ask,
Yeah.
does my daughter have PCOS? Is this what is
Right.
happening?
Right.
And it's not necessary, and it is believed that even up to 30 to 40% of girls who do not have PCOS in the classical sense may have polycystic looking ovaries on the ultrasound. So particularly,
Okay.
and I think you also know it, I think when people are very young, uh, and then sort of the 17, 18-year-old, 19-year-old, it's very common to have
Yeah.
cystic looking ovaries. So it is not necessary that you need to have, just because you see a cystic looking ovary does not mean you have sort of the full blown syndrome, as it were.
Right. Right. Okay.
Yeah. So I think there is a lot of, like I said, a confusion regarding the diagnosis. And I just want to sort of pause here to say if anybody has any doubts, concerns, please add it in the comment box and we'll try and get to questions as we go along. Any doubts, anything, and welcome to all the new people who've joined us. Um, yeah, go ahead, Soumya. You're going to say something?
Yeah. So one thing is like so basically you focus more on the clinical aspect, is it, for diagnosis?
Yes, and
And
sometimes we do get, blood tests done. You get like a series of hormonal tests done to see if anybody has PCOS. But it's not necessary. It's not necessary sometimes just based on the presentation. So let's say we get someone who comes in and she has irregular periods and she's got
yeah,
a little bit of acne,
right.
or
I think
a
the
little bit
most common, right? Regular periods. That
irregular
is when they
periods
come
tends
to
to
your
be.
clinic. Yeah.
Absolutely. It tends to be the most common. Of course, quite often what happens is I think when they have irregular periods, they usually land up seeing a gynecologist.
Okay.
They go to
They
the
get the
gynec, and the
ultrasound done. Yeah.
gynecologist is the person who does the workup for the PCOS. But
Okay. Mhm.
and then quite often what happens is that the gynecologist is the one who refers it to an endocrinologist. So, and as you can
Okay.
see that PCOS is managed by skin doctors, it is managed by
Yeah.
gynecs, it's managed by endocrinologists. I don't think it belongs to any one of us. I think all of us need to work
Correct.
together to
Correct.
manage it. So there
Yeah.
isn't like a, but yeah,
Yeah.
one of the
Set.
commonest ways. So it's
Yeah.
not necessary, like, for example, if someone comes in with irregular periods, I may just say you may have PCOS. And I think also it's important to not sort of overdiagnose it also. I'm,
Yeah.
I'm sure we are all coming across young girls, even 16, 17, who have a little bit of irregular periods, and then they're
Mm-hmm.
labeled with a PCOS, and sometimes it
PCOS.
causes a
Correct.
lot of
Yeah.
unnecessary stress.
Yeah.
Um
Correct.
and the way I would call it is query or at risk for PCOS. It's not a diagnosis which is there. It's not like something that's stuck to your forehead for life. I think that's one of the
Right. Right.
important things. I hope the message that goes out.
I
Anytime
think
we don't
stress also flares it up, right? It makes it worse
Yes,
also, in a sense.
absolutely, absolutely,
So,
exactly. So it's
yeah.
a counterproductive thing. You get stressed out because you think there is PCOS, and then that stress
Yeah.
increases the chances of you.
Yeah.
It,
Correct.
it does flare it up. So uh, stress,
Yeah.
lack of sleep, lack of
Yeah.
exercise. One of the other common things we see is, for example, students who go abroad to study, when they have a change in their lifestyle, they change,
Mm.
their sort of the day night cycle flips. And
Right.
during
Right.
the
Yeah.
lockdown, we've been seeing the reverse. We've had, young girls come back from the US, come back here to study, and then their
Yeah.
classes are sort of going on,
Yeah.
their
Correct.
online
Yeah.
classes are going on in the night. So, not sleeping properly in the night can aggravate the PCOS. So we've had people in whom it was fine when they were there, and then they come back here and
Yeah.
the PCOS tends to flare up. So, like I said, it's not something that sort of sticks with you all the time. And I think
Mm-hmm.
that's important to realize. It may come and go. It may come and go. I think that's the way to sort of think about it. It'll
I think
come,
even
it'll,
now, like because of work from home, also they tend
yeah,
to have the lack of that sun exposure, again that loss of that melatonin cycle and all.
absolutely, absolutely. Work from home, work for home is what they're
Yeah.
saying.
Yeah. Work
So,
24/7.
yeah, 24/7. Though I
Yeah.
think that's more sort of the older sort of,
Yeah.
I
True.
don't think it's the younger girls who are so much, I think it's
Yeah.
more the women in the 30s and 40s who are having a problem with that.
Yeah.
Work from home, for home, for everybody at home. Uh, but,
Yeah.
and that comes to another point, I think it's important to know that it can actually flare up at any age.
Hmm.
I'm
Yeah.
sure you've seen, sometimes we make the diagnosis even in
Right. I
girls
think
who are in
35
the,
years, 38 years also it needs to
yes,
come.
yeah. Though it's a bit unusual because it usually
Hmm.
starts happening around the the teen years, and
Yeah.
usually they sort of uh, it goes on, but it can happen at any age. It can happen, though.
Hmm.
One important thing is if it comes on for the first time. So let's say you've had irregular periods, you've had flawless skin all your life, and then at the age of 30 or 35, suddenly this comes on. We have to start thinking
Hmm.
about other hormonal problems.
Okay. Okay.
Yeah.
True.
Um,
We have a question actually.
yeah.
They've asked, is painful periods a result of PCOS?
No, no, it is not. It is not. So painful periods cannot be because of PCOS itself. PCOS is purely, I wouldn't say purely, but mostly only related to irregularity of periods. And I think, again, there's a lot of confusion about irregular periods also. right? So, and I think you and I both
Yeah.
know that cycles
Yeah.
are anywhere from 21 to 35 days. So your
Yes.
periods can be 28, it can be 30, 32, 34, 35. Even I would say if your periods are normally itself coming every 40 days,
Yeah.
but otherwise you're fine, your skin is clear, you're not having any other issue, I wouldn't label you as PCOS in that context.
So irregularity,
Painful.
like we mean more in the sense of like flow, the duration of the cycles. Like that is
It's
what we
really
mean,
the
right?
periodicity. I would say it's the
Yeah.
regularity, the
So
periodicity,
like
or the
once in 20 days,
cyclicity.
once in,
Yeah.
yeah.
Whether it's coming once in 21 days, once in 30 days, once in 35 days. Each person has that particular rhythm. But as long as
Hmm.
that's your sort of regular pattern, it doesn't really matter if it sort of goes up and down a little bit, the periods. So,
Yeah. Okay. Okay. And we have the next question. They've asked, how is hypothyroidism linked to PCOS?
yeah. I think that's a very, what can I say, the most important question I think ever, in a way, because
Yeah.
and part of the reason why there is so much confusion, I think, about the diagnosis or the label, I would say, of PCOS, uh, is many different hormonal problems can present like polycystic ovaries, can present like PCOS picture. So, for example, if your thyroid levels are either high or low, that is, the thyroid is either overactive or underactive. Uh, if your prolactin levels are not okay, so prolactin is normally a hormone that we think about with respect to childbirth and breastfeeding and things
Mhm.
like that. But outside of pregnancy and childbirth, if your prolactin levels are not okay, it can cause irregular periods and present like PCOS. So cortisol problems, if you
Mhm.
have overproduction of cortisol, it can present like PCOS. Um, if you have, there's a couple of other hormones made by both the ovaries and the adrenal glands. And if the levels of those hormones are high, it can present like PCOS. So that is where some of the confusion arises because the final picture of PCOS can present because of many different hormonal problems. Uh, and if it is related to those hormonal problems, so the way I think about it is if it's related to a thyroid problem or a prolactin problem or a cortisol problem, unless you fix that hormonal problem specifically, unless you take care of that hormonal problem specifically, you cannot control or you cannot cure, in a sense, you cannot manage the PCOS. So that
Okay.
is why
Okay.
it's important that we do a bunch of hormonal tests. We run through a lot of hormonal tests to see whether it is, what I call it PCOS, not related to any other hormonal issue.
Mhm.
Uh, if your thyroid and all of these other hormones are okay, then it's just standalone PCOS, as it were. Or it could be PCOS due to a thyroid problem, PCOS due to prolactin. In that case, like I said, unless you treat that, this PCOS may
Right.
not
Okay.
come under control. It may not be easy to manage.
Okay. Okay. Yeah, good points. I think one of the most common questions we have is like, if I have excess acne alone, do I have PCOS? You see, maybe coming with a lot of acne, like many just teenage girls, so it becomes more of a thing. So I think stress also aggravates it, but that's a very common question we have. So if I have excess acne alone, do I have PCOS?
Yeah, absolutely. And I think, again, yes, potentially you could have. Sometimes, what we've seen is the dermatologists have been managing the acne for maybe 2 years, 3 years without thinking necessarily of PCOS or just giving them, just the sort of the
Right,
usual, like,
symptomatic like that.
yeah, like contraceptive
Yeah,
tablets for whatever months
yeah.
together or years together.
Mhm.
And then you take the pill and it, clears up your skin. You stop the pill and it tends to flare up again.
Right, right.
And
Yeah.
we've seen that several times that they've not had a proper evaluation or treatment done for PCOS. So the
Mm-hmm.
short answer is yes, absolutely. You can just present with acne alone and
Okay.
difficult or intractable, difficult to treat acne. You've been on medicines, and in spite of, say, your lifestyle changes and the medicines that the dermatologist gives, the acne doesn't come under control. In spite of being on a very strict diet, it doesn't come under control. You could be having PCOS, and it is something we need to look
Mm.
at and evaluate. Absolutely.
Okay.
Yeah.
Okay. So I think
And
the attached to that one, I think next part will be like regarding facial hair. So you have this
Yes.
like I have a lot of facial hair, chin hair, the neck hair. So again, same thing. Like if somebody comes with all this facial hair, do they have PCOS?
Again, like we were discussing in the beginning, you may have just like uh, one aspect of it. You may present only with, say, with acne. You may present only with excessive hair, or you may present only with irregular periods, and you might have what is called a form fruste. You might have a milder version of the PCOS, or you might have two of these things together. So you might have just excessive facial hair, and the
Mm-hmm.
ultrasound may show some PCOS. So you might have a,
Right.
it's not a more advanced version. It's one other way to diagnose it. I suppose that is the only way to think about it. All of this are
Right.
just,
Okay.
different manifestations of a same underlying hormonal problem, whether it presents with one, two, or three, or only presents with one, or presents with two and three at a different time. So that's the other thing I
Mm-hmm.
think, sometimes people are not aware of. So you might be having a PCOS flare with a little bit of acne in your teens, and then
Mm-hmm.
that can present as, for example, diabetes during pregnancy, gestational diabetes during
Okay.
pregnancy.
Mm-hmm.
So
Okay.
that's what I'm saying. So it's like various permutations and combinations. So it's not, I think that is where a lot of the confusion occurs, because you think that you need this to make a diagnosis, you need that. Absolutely not. You might have just,
Yeah. Yeah.
facial hair alone, and that could be
Mm-hmm.
a manifestation of PCOS.
Okay. Okay. And I think next question, like, is insulin resistance linked to PCOS?
Absolutely, absolutely.
It's a
I
very big
think,
part of it. Yeah.
yeah, yeah, yeah. I think, and I'd like to know what you think, Soumya, but I think every girl who presents with PCOS has some evidence of insulin resistance. I mean, I think
Right.
it's,
Right.
do you think it's fair to say that?
Yeah, I think definitely. I think it's a pretty big portion of PCOS because I've seen like once you tackle insulin resistance, their symptoms,
Yes,
everything, right from their mood to hair fall to everything becomes a bit better also.
absolutely, absolutely. So even though, if you look at if you look at the studies, if you look at the literature, they may say 30% of women with PCOS have insulin resistance, or 80% have something like that. I would say 100% have insulin resistance.
Mm.
Uh, a large, everybody who presents with PCOS, some reason for that flare up is related to that body's insulin not working properly.
Okay. Yeah.
And then the next question turns up, why is insulin even involved in all this?
So
Insulin is just
important.
related
Yeah.
to, sugar and whatever,
Yeah.
diabetes. Why is it even playing a role, in PCOS and irregular periods? And that's a very, very fascinating, interesting point. And one of the things that really triggered my interest in PCOS uh, is because the way we have evolved, we need a certain amount of body fat to be there before we are capable of giving birth.
Mm-hmm.
So that signaling about determining whether your reproductive axis, as it were, whether you're ready to bear a child, whether your body is ready to have a baby, is partly determined by your fat stores, which in turn is determined by your insulin.
Okay.
Uh, so another way to think about it is your fat store has to be just right. It's sort of like a Goldilocks thing. If you
Mm-hmm.
have too little fat also, you will have irregular periods, right? So there are people who have,
Mm-hmm.
what is called lipodystrophy, and they don't have enough fat in the body, interestingly.
Right.
So
Right.
if you have
Yeah.
too little fat also, or people who are very thin,
Mm-hmm.
anorexia, I think famously, I don't know how many of you would remember, there was a group called the Carpenters, you know. Gosh. Oh, you have to listen to them. You have to listen to them.
Sure. Yeah.
So yeah, yeah, yeah. You have to listen. They're fabulous. They were a big group in the
Okay.
70s. So obviously I'm dating myself. So
I'll look
yeah,
into it.
yeah, please do. So I think they were a brother and sister. Yes, they were a brother and sister duo,
Okay.
and the sister was Karen Carpenter, and she
Okay.
was, she was a famous singer then, and she developed anorexia. So the reason I
Okay.
was leading up to that was because anorexia, where you lose a lot of weight,
Mm-hmm.
you will start having irregular periods. So the fat
Okay.
in your body has to be in the Goldilocks zone. You need to have just right. It shouldn't be too little.
Okay.
It shouldn't be too
Mm-hmm.
much. right? So when you have too much, and that is what happens when you have too much fat and you gain a lot of weight, particularly around the stomach area, your body doesn't work, the insulin doesn't work properly, so your periods become irregular. But if you lose a lot of weight also, so a lot of athletes, for example, a lot of athletes, like ballet dancers, very, very thin, their BMI is very low, also tend to have irregular periods.
Yeah.
So the body fat has to be in that nice little Goldilocks zone for your insulin to work properly, so that your periods are regular. And that, like I said, is related to evolutionarily, it is related to the fact that you needed to have a certain amount of body fat to be able to bear babies, have children, so that you can carry them through a pregnancy. Interest. That's where the sort of your fat stores and insulin resistance comes into play. So if you go above a certain level and your body's insulin doesn't work properly, the whole sort of PCOS tends to flare up. It flares up. So not too low, not too high. Not too low, not too high. We'll be talking a lot about insulin resistance. And one of the reasons why I'm saying that every girl with PCOS has insulin resistance is because insulin is a hormone that has an effect on every cell of your body, right? Apart from maybe your red blood cell or something, but insulin is needed for the normal metabolism, normal working for every cell of your body, which is why when you have insulin resistance, you have so many different type of pictures. That's why, like we were discussing, some people just present with acne, some people present with, we haven't talked about another common manifestation of PCOS, which is acanthosis. Some girls have this darkness, dark lines around the nape of the neck, or they have something called skin tags, like little, like out things, tag in the skin, particularly in the neck area. That is again related to the insulin resistance. So the skin is a very important, you don't even have to sit and do very complicated blood tests.
Right.
You can start noticing a little bit of thickness. Yeah, all that is a marker of insulin resistance and very, very closely related to PCOS. And because that insulin works in every part of our body, starting from our brain to our skin to our liver, lung, heart, gut, every single part of your body needs insulin to work properly. Which is why if you see a lot of the girls with PCOS or people who have insulin resistance will also have fatty liver, right? I'm sure you've seen that, when we do our low carb clinic, fatty liver is so common. It's very common for them to have sleep problems because of the weight. They have a condition called sleep apnea. They don't sleep properly, which is probably one of the reasons it affects their mood. Because of that insulin resistance, apart from, all these skin things that we are talking about and the irregular periods, it can affect your gut because again, insulin is needed, action is needed for proper working of your gut. Insulin action is needed for proper mood working of your brain. So that is why when the insulin doesn't work properly, it affects like every single organ in your body. That is why I'm saying that PCOS presents in so many different ways. And it is important as doctors that we understand that this is it is a manifestation of the insulin resistance, because so often just tackling that insulin resistance, and means that when you reduce that, when they lose weight and they start exercising regularly and you get rid of that insulin resistance, a lot of these manifestations will come under control. They feel much, much better.
I think one of the points you told regarding that skin tags and acanthosis, it's very under reported. Like patients usually will tell, no, அது சும்மா dark இருக்குன்னு சொல்லிட்டு I think it should be stressed more that it's a very important clinical sign and not just like a cosmetic thing.
Absolutely. Yeah, it is a marker of, absolutely right, a marker of something very important going on inside, a marker of, and I know you've had several people doing very well on the low carb program when you worked with them. Have they also noticed improvement in their skin?
Yeah, I think definitely one thing is just in general, I feel they're telling the skin becomes a bit more clearer. I think maybe due to less oily, like oil and all. But second is we always check their acanthosis also. So initially, a lot of people they have very darkening, maybe in the back of the neck will be quite dark. So after some 2 to 6 months, they will notice actually come down. It may not go away completely, but at least it is a significant reduction will be there in the level of darkness.
And I think one of the other things which you would have noticed, which I wanted to talk about, is it's not like a dramatic amount of weight reduction occurs, right? Before they start noticing an improvement.
Yeah, definitely. Yeah. So I think initially they may lose, initially with the water weight being lost, they will, after starting any diet with the carb reduction, they will lose about 2 kilos. But after a very gradual weight loss, more of a size loss, mainly abdominal fat will start to decrease first. So gradually over the next 2 to 4 months, they will notice their size will start to go down as if excess fats will all get burnt off. You do have a weight loss also, but I think a more significant factor for like good progress will be a size loss rather than seeing the visible weight loss.
Yeah.
So
So I know
I
like
usually recommend them to.
yeah,
I usually tell them to stop seeing the weighing scale so much. It's not so important. You just see how your clothes fit, how do you feel, and all that. Yeah.
absolutely, absolutely. I mean, that's so important because I know you measure their or get them to measure their waist circumference,
Right. Yeah. Yeah.
and I know you've been writing in, several people who had like significant reduction in the waist
Mhm.
circumference, even if the weight is not changed. They've
Correct.
lost
Correct.
like,
Yeah.
4 or 5 centimeters from around the waist, and they've had
Yeah.
significant improvement in their PCOS because of that, because they've lost that
Right.
that
Right.
particularly for some reason the fat accumulation around the tummy is like the worst.
Exactly.
So fat
Yeah.
accumulation, for example, in your hands or your thighs, does not
Mhm.
affect your insulin so much as that fat accumulation around the tummy for
The
some reason.
abdominal fat.
Yeah, the abdominal fat. That's a very, very interesting. I don't think anybody really understands why fat in that
Mm-hmm.
area alone is so bad. It's a different type of fat.
Right.
We understand all that.
Yeah.
It's a very, very interesting, thing about that fat accumulation in that area.
Mm-hmm. Yeah. Right.
I think,
I just had a
yeah,
question. Yeah.
yeah, yeah.
Sorry.
Go
Go
ahead.
ahead.
There was
Yeah.
something about some
Um.
scan or something. I saw it flip fast.
Yeah. Yeah. What is a diagnostic condition that helps in identifying PCOS in someone? Generally, the scan is believed to be like the one diagnosis.
And I think again, the brief answer is no. You don't need to have a. You can have PCOS without the scan showing PCOS,
Right.
and you can have a scan which shows PCOS, but you may not have the PCOS.
Yeah.
I don't know if
Yeah.
that's like too confusing. It
Right.
probably is, but you do not need to have a scan appearance of PCOS to make the clinical picture. There
Yeah.
isn't one single test I can tell you that you go out, you get this done. If it's positive, you have
Mm-hmm.
PCOS. It's not like, the corona, the COVID test or something where
Mm-hmm.
you can
Mm-hmm.
hang your hat on it. There isn't any one. There isn't a test like that which says that you do have PCOS. That is why I'm saying the manifestations as doctors, we have to be aware of the myriad manifestations of insulin resistance. It might be somebody who just comes with, a little bit of facial hair and fatty liver, and
Mm-hmm.
I might think she has polycystic ovaries.
Right.
Or she might have a flare up of acne with a little bit of elevated uric acid. Her blood sugar may be normal,
Mm-hmm.
but her uric acid may be high, or her triglyceride may be high. And I
Mm-hmm.
know that she has insulin resistance with a little bit of PCOS going on there. So uh, it's, I wouldn't say it's like a fishing expedition, but we have to be very cognizant of the very, very many ways. It's a multifaceted presentation. That's the only way I can put it. So we have to be very aware of uh, the many ways in which it can present, so that we can give the proper sort of uh,
Mm-hmm.
treatment, diagnostic
Treatment. Yeah.
treatment. Yeah, yeah.
Mm-hmm.
Or for
And like.
example, we didn't touch upon this because we don't usually see it, but fertility. Fertility. I was talking
Mm,
about why
right.
the
Right.
body fat is so important. It has to be at a certain level before you start getting your periods, or to maintain the
Mm-hmm.
regularity of your periods. But it's also important that PCOS is sometimes diagnosed when girls come for evaluation of infertility.
Right. Right.
And like you said, PCOS is becoming so much more common, and we know that
Mm-hmm.
infertility is also, I think, keeping pace. Partly because of this increase in obesity, because of the increase in the insulin resistance. And I wouldn't even say obesity. I think it's just a change in the lifestyle.
Yeah.
Uh,
Yeah. I think more sedentary, like lack of exercise, high fat diet, high fat and then high carb, high fat diet. So.
yeah, high fat, high carb, and also sitting with your,
Yeah.
the the devices
Right.
at all times.
Multiple devices.
Yeah, yeah.
Yeah.
And getting hooked on to, like whatever, like Korean shows, like I am.
Yeah.
So
Yeah.
getting hooked on to, binge watching shows. Um,
Correct, correct.
yeah, but uh, yes, and not just binge watching shows, exposure to light at night. I think that's like a very
Correct,
uh,
correct. Yeah.
important part of why our hormones sort of go out of whack. Exposure to light at night is bad for us. It affects our
I think that in a
hormones.
way, like that light dark, we do need, right? Like lightness from this. It actually it makes a big impact on our brains functioning and all. So,
Absolutely. We are so out of
yeah.
sync with our, just because we have, artificial light, we are so
Mm-hmm.
out of sync with the the sun's rising and setting sort
Yeah,
of, and the
correct.
importance it has on our body's hormones. So certain hormones are only
Mm-hmm.
made when we sort of get up in the morning, and certain other hormones are only
Mm-hmm.
made when it is dark outside.
Mm-hmm. Yeah,
Ideally, we cannot do that because of the way modern life is, but ideally we should try and go to bed when it's dark outside and wake up when it's light outside, as
right,
much as you
right.
can, as much as you can.
Yeah,
But I don't think any of us can go to bed around 7 and wake up at
yeah,
4.
yeah.
Very, very, very rare, unless you're going to whatever, do
Yeah,
something early in the morning. Otherwise, you never do
right,
it.
right.
Uh,
Mm-hmm.
but it plays havoc with the hormones, both for men and women. I'm not saying it's only
Mm-hmm.
for women. I think for men also that's
Correct.
important.
Yeah.
But unless we are cognizant of it, unless we were aware of it, and I think that's
Mm-hmm.
one of the things you counsel, no, Soumya, because unless they sort of follow the day-night cycle, they'll find that losing
Yeah,
weight is very difficult.
correct, correct. Yeah. So they don't have some sort of structure needs to be there with in relation to the sunrise and sunset pattern also. So it does help them away them out.
And also interestingly, because when I was reading about this exposure to light at night, and all its sort of ill effects on our body,
Mm-hmm.
I realized that even when we switch off everything in the night, we still have, like if you have the TV in your bedroom, you still have that light from your
Yeah,
TV, that red light
right,
on,
right, right.
and
Yeah.
or
Maybe
there's a
that's
blue
also
light on
impacting them.
somewhere. Yeah. The
Okay, okay.
Even that, like for example, I'm just looking at my charging wire here in the room, if it's on in the night,
Uh-huh.
charging up my phone, that red light.
Okay.
And interestingly, they've shown that even, I mean, obviously it's not as bad as just staring at something, but
Yeah,
even
yeah.
that amount of light may play a role. And when a lot of people ask for, problems sleeping, this might be one of the reasons,
Mm-hmm.
this
Correct,
sort of
correct.
this
Yeah,
constant exposure to light
yeah.
in the room.
And
So
I think I've experienced so many times. So like I'll be so sleepy around 9 p.m. or 10 p.m. But I'll just have that particular the test. I'll just see those Facebook notifications, and I'll be become so alert. So all that sleep goes out the window. It'll be like take another 2 3 hours to go back to sleep. So I think I become more alert looking at all this,
yes,
despite light being
absolutely.
on.
No, it's a
So
stimulation. It's a stimulation. You need that
yeah.
period of
Right. Mm-hmm.
like calming down, quieting down, I think, before we go to sleep. And all of us have to
Yeah.
work on it. Like you say, unless if you miss that little
Exactly.
window
Yeah.
of sleep, then
Mm-hmm.
you can't go back to sleep.
Exactly. It takes 2 3 hours to go back to sleep again after like
Absolutely. And that's how you
yeah.
become addicted
To
to
binge
TV
watching shows.
serials.
Okay, I'm not anyway. I'm awake. I might as well watch something.
Yeah, you have to do something now to occupy your
Yeah,
time.
correct. I think that's when they start having food also. That snacking and that binge watching. That is, I think,
Yes.
that window is quite important. I think so.
Absolutely right. Absolutely right. When you're, at 11,
Yeah,
you're convinced you're hungry, even though you've had a good dinner at
yeah,
9.
exactly. Yeah,
Between 11
I
and
think
12,
it's
you're
more.
convinced. Yeah. You want to eat something,
Yeah,
you get up, and it's
right.
absolutely not good at all to do that. Your body doesn't at all need that
Hmm.
energy.
Yeah,
Uh, but it's very, very, difficult to not eat at that point in time.
yeah.
So sleep hygiene, I think, is something maybe we'll try and cover it, but it's very
Hmm.
important whether it's for PCOS or just for anybody who's trying to sleep. Of course, students sometimes will have periods when they are preparing for projects, and so for like 2 3 months. Especially,
Mm,
I've seen
yeah.
this for some reason. I don't know why. The ones who seem to be most sleep deprived, surprisingly, are architecture students and CA, people doing their CA. For some reason, these are the two
Okay.
people who always come and say that they don't sleep, they don't
Okay.
sleep. Even
Only
more than
students.
doctors, interestingly.
Is it?
We
Okay.
think for us it's like an occupational hazard, but
Yeah.
yeah. So
Okay.
I think sleep hygiene is a very, very important aspect of it. Turning
Mm.
off all light sources. Like I said,
Right,
even the
right.
charging wire and and
Mm-hmm.
any little stimulation that you have, we have to try and shut it all off.
Mm.
And try and get a good night's sleep. That's very essential to get your hormones back into balance.
And just a couple more questions I had here.
Yeah.
So should we take metformin regardless of the test results? Like once, I'm assuming once I diagnose PCOS, should they take metformin?
Yeah, so that's actually a very, very interesting question, because so far we were saying only give metformin if your blood sugar is high or things like
Mm-hmm.
that. But like I said, I think insulin resistance is a large part of every person with PCOS. It's there in every person with PCOS.
Right,
That's why they're
right.
presenting with PCOS.
Mm-hmm.
Uh, if you can achieve the reduction in insulin resistance with diet and exercise, nothing like it. The problem with using metformin is it works for as long as we are giving it. Once we stop giving
Mm.
metformin, you're going to bounce back to the original level of insulin resistance. So uh, I think there is no harm in trying it, but along with diet and lifestyle, along with lifestyle changes, along with a good low carb diet, along with weight reduction. So all of these things need to happen side by side. And the other question that always arises is, once you start on metformin, how long am I going to take it? Is it going to be for life?
Mm-hmm.
How long do I give it for? Quite often what happens is, when you give the metformin, there is some result. People lose weight, the periods start coming regularly. Once you stop the metformin, the problem comes back, it recurs.
Right, right. Okay.
So I wouldn't say, I don't think it's a bad idea to at least consider it in everybody. I think it's not a bad idea to at least consider it. Whether I would start it in everybody is a different. I don't think so. I don't think so. I think we have to use it judiciously, and it does help. It does help in a large proportion of
Mm-hmm.
people.
So
The,
along the management lines, the next question is quite a big one. How to control weight? That is like
why don't
multiple
you?
sessions are needed. So
Yes, exactly. I wish there was an easy answer. I really wish there was an easy answer. I think the easiest I've seen, and having, tried many, many things over the years, I think low carb really works. Um, and I think you can also vouch for it, Soumya. So
yeah, yeah.
low carb works for many, many reasons. One of the main reasons being, when you eat less carbs, your body makes less insulin.
Mm-hmm.
So insulin is what we call an anabolic hormone. Every time you eat something that makes your body make more insulin, you're going to gain fat. You're going to gain weight. You're going to gain fat. So what is the thing that makes your body make a lot of insulin? It is refined carbohydrate and sugar.
Mm.
Whereas in general, interestingly, fat, you don't require any insulin at all to metabolize fat. Not that I'm saying, and which is why what is called so-called LCHF, the low carb, high fat diets, are helpful in weight reduction. The
Mm.
problem with such diets tend to be the long-term side effects and maybe the sustainability.
Mm. Mm.
Is it safe to eat that amount of fat in the long term? I don't think so. And you just cannot live on, just eating like tons of butter and tons of ghee and everything roasted in
Right,
ghee all the
right.
time. So that is why I think, and I'll ask Soumya to also talk about this, we've sort of developed more of a low carb, moderate fat, don't be afraid of fat, moderate
Right,
protein
right.
diet.
Yeah.
That is the way I would label,
Yeah,
I
yeah,
think,
correct.
the diet counseling that we do, right?
Yeah,
So low
correct,
carb.
correct. Yeah.
So, but in as much as anything works for weight reduction, I think low carb really works if you're able to cut down the carbs to less than about 50
Mm-hmm.
grams a day. You won't go into ketosis with that level of carbohydrate intake, but it
Yeah,
makes it much easier to lose weight, makes it much, much easier
right.
to lose weight if you're able to maintain
Mm-hmm.
that level of carb intake.
Yeah. I
And
think more just like
yeah,
having like just half the amount of carbs, even if you're not able to maintain long time, just like current diet, if you just cut down carbs, especially the white sugars, all the white rice and all, that makes a very big impact because you see like starting from coffee, you take that 2 or 3 spoons of coffee 3, 4 times a day. That keeps adding up to a quite significant amount of sugar throughout the day. So the small changes can also play a big thing in the long run.
Absolutely. And I think, I mean, there are so many benefits of the low carb diet. Since you mentioned coffee, I just wanted to say, one of the things that I think we've noticed is that the cravings go away with the low carb diet,
Right,
the
right.
craving for
Yeah,
sweets or the craving for sugar or the craving, when is my next meal? When is my next meal? When am I going to eat? When am I going
correct,
to
correct.
eat? That
Yeah,
craving sort of goes away when you're on a good low
yeah.
carb. Because I realized at least when I, started doing it more regularly,
Mm-hmm.
is that when you eat a high carb meal, your sugars go up and down. And then by the
Right.
time it's
Yeah,
starting to come down, you get hungry again and you're craving, you want to eat anything. You go and eat your sweets, your cakes, your pastries, whatever you eat, everything.
yeah.
Whereas if your
Correct.
sugar is more steady, it's going up more gradually, coming down more gradually, at least you're not, so hungry for food. I think, Soumya, you're lagging a bit. I don't know if Soumya can hear us. I think there's a question here from Nishi. Could you also tell us a bit about low or normal BMI PCOS? And I'm not sure if you listened in earlier when I was talking about the Goldilocks range for fat in our body. Uh, Even when the fat is too low in our body, so that is why we have people who are very low weight who also have PCOS, and even in them, insulin resistance also plays a role. So it's not that you have to be overweight
Right.
or significantly overweight to have PCOS. Insulin resistance. Insulin
Mm-hmm.
resistance can also happen in people who are thin. Uh, it
Yeah.
and why does it happen in people who are thin, who may be at their optimal body fat? It happens because of hereditary reasons, what we call genetic or hereditary reasons, or it can happen because of lack of exercise. So when you're not
Mm.
exercising, your body's insulin pretty much goes to sleep almost immediately. So exercise is a very important part of it. Um
Mm-hmm.
a significant proportion, I would say at least about 3 to 4 out of 10 girls with PCOS that I see are actually low or normal BMI. So it's
Right.
not necessary that you need to have a high BMI, but I think the question really is, do the low or normal BMI people also have insulin resistance? And the answer is yes. They also
Mm-hmm.
have insulin resistance. The fact that they're presenting with PCOS itself in my book means that they have insulin resistance. If you may not be able to diagnose insulin resistance using the usually used methods. Their sugar level may be normal,
Mm-hmm.
you know, but if you do, the fact that they have PCOS in my book is equal to the fact that they have insulin resistance. And if you treat that insulin resistance aggressively enough, get them to exercise, make sure that you've addressed all aspects of that insulin working, you will be able to find an improvement in the PCOS.
Yeah. And I think another one we had is what age can you get PCOS? We've briefly covered it before, but at what age can you get
Yeah.
PCOS?
So I think most often we make the diagnosis of PCOS. I would say don't make a diagnosis of PCOS before the age of 19. I think that's one
Mm.
important thing, before the age of 19 or 20, because soon after you start getting your periods, you have all sorts of things. You may have a little bit of facial hair, you may have acne, you may have irregular periods, which may go on till the age of 18 or 19. So I
Mm-hmm.
don't think it's important that we don't even label somebody with PCOS tag till after the age of 19 or
Mm-hmm.
20 years.
Okay.
Um, if I see somebody, the most common age of presentation for PCOS, however, tends to be the late teens and early 20s.
Okay. Okay.
But like I said, sometimes we diagnose PCOS when girls come in with, say, in their early 30s with difficulty conceiving,
Right.
and
Right. Yeah.
they've had, you sort of look at them and you know that it is PCOS. Of course, for
Mm-hmm.
as far as I'm concerned, as an endocrinologist, for everybody, we would go through all the tests, whatever be the
Mm-hmm.
age at presentation. But somebody who's had a very regular periods, very clear skin till the age of 35, and then suddenly presents with something that looks like PCOS,
Mm-hmm.
I'd be a little bit more doubtful about whether she had truly PCOS or not. But it can
Mm-hmm.
present at any age.
Okay.
Like we were discussing in the lockdown, in the beginning, in the early part of or whatever, in the middle of the lockdown, I
Yeah.
think a
Yeah.
lot of women staying at home, lots of snacks,
Yeah.
lots of cook at home in the
Yeah.
in the
Yeah.
earlier stages of the lockdown.
Experimentation.
Yeah. But
Yeah.
interestingly, what I found was a lot of people actually were much better off, I think, metabolically. Of course, they may have gained weight, but a lot of them felt whole lot better, and their skin cleared up.
Actually, I
Everybody
think
said,
initial 2 months we didn't have the restaurants and all, right? So I think it made a very big impact. It was like only home cooked meal. Maybe snacks will be there, but I think the lack of restaurants, I can tell, it made a big impact in the
yes,
diet control and all.
yeah,
So
absolutely, absolutely. I think it was, and I think because I know everybody came and said their skin cleared up, they had better
yeah.
hair growth. So lots
Oh,
of
good.
like good things over the.
Yeah,
I think
yeah.
because anyway the salons weren't open, so nobody anyway went for a
Yeah,
haircut.
true. Yeah.
Yeah. So some good
So,
things about the lockdown. A lot of good
yeah,
things.
yeah. Correct, correct. And in terms of management,
Yeah.
I think one of the points that they do recommend is hormonal treatment. So, is it safe to take hormonal treatment for management wise?
Provided we are using it for a brief period of time.
Mm, okay.
So, and I think there's a lot of, I would say, country bias or cultural bias related to that. So, for example,
Hmm.
in some countries, there is no hesitation about putting young girls on the contraceptive pill and leaving them on it for
Correct,
years
correct.
together.
Yeah.
Now, if you need to be on the pill for contraceptive reasons, that's a different matter. But
Hmm.
would I use contraceptive tablets alone as a treatment for PCOS for years together? Never. Absolutely not. I would not. I would not recommend it. I would not do it. I do
Hmm.
use, and you've seen it also. I do use contraceptive pills for say 6 months to 1 year to help to clear up the skin,
Right.
but never just to regularize the periods. I might use it at the most
Mm.
maximum 6 months, 1 year, and then give a break if necessary. Put them back on it a little bit later for say two to
Correct, correct.
three months. But this sort of this thing about, oh, okay, you have PCOS, fine, putting them on the pill and forgetting about it and saying that that is the treatment for
Yeah.
PCOS is, so like, what can I say? I don't want to say counterproductive, but it's so wrong. It's so wrong on so many levels
Right.
because it's not
Right.
addressing the underlying,
Correct, correct.
the
Yeah.
etiology. Why is that
Hmm.
PCOS happening? It is not addressing that
Hmm.
insulin resistance. So, uh, yes, it is safe if used appropriately. So
Mm.
I don't want people to also go to the other extreme where they, um, uh, stop using the pill because of
Hmm.
uh, their worries about contraception, about using a hormonal as a
Right, right.
so-called hormonal tablet.
Hmm.
But leaving them on people, there are side effects to every medication, and the pill is a medication. It is it is not
Yeah.
a hormonal,
Hmm.
it is not a natural thing in our body. So, if you use it judiciously with the proper precautions, I don't think there is anything wrong with using it.
Okay.
Yeah. So, but we do have to be careful. We do have to have a think about it. Yes.
Yeah. I think as it was a cultural thing also, cultural wise, country wise. I think in India, our treatment will be different than those in Europe or America also. So,
Absolutely. So, in those countries, from what I've seen in general, there is more of a, I mean, I don't want to generalize, but in general, the tendency is towards putting people on the pill and leaving them on it for years together.
hmm,
And I think it's also to
yeah,
do with the fact that it works as a contraceptive, and
yeah.
which is fine. Uh,
Hmm.
but we do need to be aware of, be aware that it is a pill. We are sort of altering our hormones.
Correct, correct.
I
Yeah.
would be concerned about, particularly about the age of 30. I think up to the age of 30 or
Hmm.
35, I'm okay with it. But uh, where would I be
Right.
concerned about using the contraceptive pill? I would be concerned about using it in someone who is very overweight. So let's
Hmm.
say someone who's above the weight of say 90 or 100 kilos or something, or people who smoke, I'd be more concerned about
Hmm.
using it.
Right.
People who are above the age of 30 or 35 who also have hypertension, or who also smoke, I'd be very, very concerned about using it in the long term.
Mm-hmm.
So we
Right,
have to
right.
be very careful about the people that we choose and we use it. Young girls in general
Hmm.
should be okay. I wouldn't worry about using it for a short period. It does not affect things like future fertility. That's a
Hmm.
common sort of concern about it. If I take it, am I not going to be able to conceive? And the answer is no, not at
Hmm.
all. It doesn't affect
Yeah.
your future fertility. But
Hmm.
it is a tablet, and I would be careful about its use. Yeah, particularly in smokers and obesity and things like that. So
Okay. I think that's it. I think no further questions mentioned
no
here.
further. Okay, fine.
Yeah.
That's fine. I think we're sort of coming to an end
So,
anyhow.
yeah.
Um, I think there's one
So we
final
have one.
question. Maybe we'll finish
Yeah.
with that.
Yeah. So, what would be a judicious use of the pill? And what would you say is the best line of medical management overall?
Yeah, I think that summarizes all the the full sort of the
Yeah.
discussion we had today.
Right, right.
Like I said, the
Yeah.
judicious use of the pill, in my book, I only really use the pill for skin. I use it to
Mm-hmm.
clear up acne. I use it to sort of reduce the hair growth, um,
Mm-hmm.
along with laser treatment if possible. Very
Right.
rarely do I use it just to regularize periods, because that's very artificial. When you're giving it, the
Mm-hmm.
periods are regular, but after you stop it, it's going to become
Right.
irregular
Yeah,
again.
yeah.
So, it's not this thing. And I think I mentioned the sort of the situations where I'd be very careful about its use. So people who are
Mm.
particularly smokers, who are overweight, above the age of 35, high blood pressure, high cholesterol. So always before
Mm-hmm.
starting the pill, I check a cholesterol anyhow.
Mm-hmm.
Maybe I'm
Right.
paranoid, but I do check the cholesterol. So the older you are, the more your blood pressure, the more if you're a smoker, all these are things that stack up with
Mm-hmm.
side effects from the pill. So I'd be a bit careful. And always be very clear why we are using it. Are we using it for contraceptive reasons? Are we using it for skin? And once you've achieved
Mm-hmm.
what you want to achieve, then I would stop it. I would not continue giving it
Okay.
longer than that, and find other ways of
Mm-hmm.
treating the presentation. We can talk about management. This thing. The best line of medical management, I don't think I have an answer. It's a very tailored
Yeah.
approach. It's an extremely tailored approach. It depends on what is bothering you the most at this point in time. Is it your skin? Is it your periods? Is it the fact that you want to try and conceive? Is it
Right.
your sugars? Is it your fatty liver? Is it your
Mm-hmm.
insulin resistance? It depends on what's bothering you the most, because based on that only we would tailor. So there isn't a one size
Mm-hmm.
fits all ever for PCOS. There never is. We
Right.
have to pick and choose the treatment and fit it to whatever, like I said, is bothering them at that point in time. But controlling insulin resistance, I think, is the best medical management, as it were.
Yeah.
So, so whatever gets you there is
Yeah.
the management.
Right. Right. Sure.
I'm seeing a lot of familiar faces, and thanks to all who sort of came in for and joined us. So it's very nice. I think Soumya, any other final thing?
No, ma'am, that's it. So it was a good session. It was a good session. So I'm looking forward to further
Yeah.
sessions
So
with
like
you.
I said, it's like an ocean to sort of thing, and you know, uh, next week I think we'll focus upon. I think we'll have diet and exercise and all later. I think let's focus upon like lifestyle, because I really find that fascinating.
Yeah.
So let's talk about, for example, what you were talking about, stress, and what I
Mm-hmm.
was talking about, lack of sleep,
Right.
exposure to light
Less
at
sleep
night.
and.
Yeah, let's
Mm-hmm.
talk about that and why it affects insulin resistance. Let's have a discussion
Okay.
about that, I think. Yeah.
Sure. Yeah. Yeah.
Okay. Thanks,
Okay,
Soumya.
ma'am. Thank you so much. Thank you
Thank
so much,
you.
ma'am.
Bye. And thanks for
See
everybody
you
who
next
listened
week.
in.
Yeah.
Yeah, thanks. Bye-bye. Bye.
Bye.
Bye.